Hello everyone, Dr. Sindhu. Today I'm going to tell you about second trimester of pregnancy. So what are the important things you should know when you're in the second trimester of pregnancy, and what are the symptoms you will see in the second trimester of pregnancy, and what are the changes you see inside you, and what are the changes, how the baby develops inside, and what are the important tests and scans and screening tests you should definitely do when you are in your second trimester of pregnancy. So second trimester is usually the calmer and a cooler period of pregnancy, I would say, because all your symptoms, whatever you had felt in the first trimester, slowly they'll start to disappear. Your nausea, your vomiting, your fatigue, your abdominal cramps and everything. So slowly these symptoms might settle down, especially if you're a person who had too much of food aversions or anything. So slowly it'll all go off, and high sensitivity for your smell and everything. Slowly things will settle down in the second trimester. You will start feeling good. Your mood will be lifted. And you might feel more hungry. You might start eating well. So you should definitely start eating healthy, and you should start eating well in the second trimester. So the symptom wise, you might find a little bit different symptoms when it comes to second trimester. Like first and foremost is you might develop having multiple body aches, in the sense you might start feeling abdominal cramps and leg cramps and back pain, especially because the shape of your back is changing in the second trimester to accommodate the outgrowing tummy, because the baby is growing inside. The tummy should come out and your back should undergo some changes to accommodate that baby which is growing inside. So some people can have this dark patches on their nose and cheeks and everywhere. That's called as a pregnancy mask. So you don't have to worry much about it. Slowly, once you deliver the baby, these markings, these dark pigmentation will go off. And some people can develop hemorrhoids, or you can have more constipation. So you don't reach a stage where these things will get very severe. At the beginning stages only, try to increase your fluid intake and include fruits like bananas, the prunes and everything. They are natural constipation relieving agents, so that will definitely help you with that. And try to wear some loose fitting clothes. It would be a good time to go for some maternity shopping. And try to avoid high heels. It is not good to wear high heels during pregnancy. It is not good for your back as well, because already the back is under strain. Wearing high heels will put more strain upon your back. And I guess that's it when it comes to the symptom wise in the second trimester. But there are things which you should watch for. First and foremost is your sleeping pattern. How you're sleeping is very, very important, because the growing tummy, it should not put pressure on your vessels inside you. Try to sleep on your left side or the right side. If you don't want to sleep on your sides, it doesn't matter. If when you're sleeping flat, try to put like 2 or 3 pillows at least. Keep your head and elevated when you're sleeping. So that should be your sleeping position. And drink plenty of water. So this is the period where you will get more of urinary tract infections and vaginal infections. So, and you might have all these cramps. So most of the time these symptoms will be because of less intake of water. So it's very, very important. Sleeping position is very important. Drinking plenty of water is very, very important. And eating healthy diet. What you should diet? Is there any difference between what you should take in the first, second trimester or the third trimester? There is no major difference when it comes to what you should not eat. As I have told you many times in a video also, where I have mentioned about diet in pregnancy, what you should not eat in pregnancy. That holds good for all the trimesters of pregnancy. You should avoid all those things like processed meat, raw meat, deep sea fishes, alcohol, smoking, all those things, unpasteurized milk and soft cheeses. So this holds good for all trimester. When it comes to eating, second trimester would be a good time where you should look for foods which are very rich in iron, calcium, vitamin D and protein and omega-3 fatty acids. So iron, calcium, vitamin D, omega-3 fatty acids. So all the three nutrients you might be getting as a supplements as well. But it is a good idea to include foods which are rich in all these things in your diet as well. Especially the broccolis and the spinach, pomegranate, watermelons. So these are all very rich in iron and calcium, and along with that try to take vitamin D also. Vitamin D will help promote the calcium absorption. Try to roam around in the sun, okay? That's a very natural and a good way to get vitamin D. Yeah, so and omega-3 fatty acids, which are very important for the brain development of the baby, okay? Tofu, salmon, yeah, and the spinach, the quinoa. So these are all the foods which are very rich in omega-3 fatty acids. So try to take it, and you will be prescribed by your doctor also all these supplements, but try to include all these things in your diet as well. So that is about your diet and your body changes, what happens in the second trimester. So next, coming to the baby. So baby is fully developed in the second trimester. By the time you reach 20 weeks, you will be fully developed. By 18 weeks to 20 weeks, you might start feeling the baby movements as well. Okay, most of the patients ask me at 20 weeks they're not feeling the baby movements, and they're a bit worried. But sometimes if you have a very thick abdominal wall, if you're a bit on the obese side and all, you might not feel the baby movements till you reach 23 or 24 weeks also. So it's common, and it's important to keep a pregnancy journal and note down all these important events which happened when you first felt the baby kicking, and when you first heard the baby's heartbeat in the first trimester. So there are important milestones which you achieve in each pregnancy. Yeah, first would be when you heard the heartbeat, and second is when the baby reaches 12 weeks, and when between 18 and 20 weeks where baby is completely formed and you get your anomaly scan done and everything. So it's a good thing to keep a pregnancy journal. Yeah, so baby would be fully formed, and baby would measure around 14 to 15 inches at this stage, and they would be around 1 kg by the end of first trimester. So 18 and 20 weeks you should get your anomaly scan done. If by any chance if you have not done your double marker, the Down syndrome screening, which I told you in the last video about the first trimester of pregnancy, if you happen to miss that, the second trimester would be a best time to do the triple marker screening, which is done between 14 and 18 weeks. Yeah, you can do a triple marker or the quadruple test. So if you have any doubts regarding this, you can discuss with your doctor and about how to do about this test and everything. So it's important that you should know that these are the tests which are available in the second trimester. Yeah, so triple marker and the quadruple test and the anomaly scan between 18 and 20 weeks are very, very important. And if you have any history of cervical incompetence and everything in the previous pregnancies, try to get your cervical length checked every now and then, at least every 2 to 3 weeks till you reach 18 to 20 weeks to know the cervical length. So mid trimester is the time where you will have this cervical incompetences also. So that's one extra thing. And next is at 24 weeks, if you want to know about the fetal echo, if you had a baby who had any congenital heart diseases or anything in the first pregnancy, or people who are over diabetics, who are GDM on high dose insulins and everything, so you would want to know about the baby's heart. So 24 weeks is the time where you can get a fetal echo done. So it's not a mandatory test to be done for all the pregnancies, but if you are willing to do it, so 24 weeks is the perfect time to get it done. And between 24 and 28 weeks, your screening for diabetes also will happen. You will be asked to do either glucose tolerance test or glucose challenge test. Okay, there's the slight difference is there. In glucose challenge test, you don't have to be in the fasting and all. Any time of the day you can just go in and drink a 50 grams of glucose water what they give, and you have to check your sugar levels after 2 hours. Otherwise, one advanced, if GCT is a bit high, then we'll go for that advanced one. It's called as GTT. So I prefer doing directly the GTT first. So you will be given asked to come in the fasting, at least 8 hours fasting, and after that you will give a fasting blood sugar, and you will drink 75 grams of glucose, and check your glucose at the end of 1 hour and at the end of 2nd hour. So that's for screening for diabetes. It's very, very important to screen all the pregnancies for diabetes, because 24 to 28 weeks is the time where your body will be resistant to insulin. So these are the important tests and important scans which you do in the second trimester. So I told you about the symptoms, the diet, what you should consume, and what are the tests and everything you should do in the second trimester. So when it comes to second trimester, there are some danger and warning signs you should definitely be aware of. So first and foremost is the baby movements. Baby movements might not be very significantly appreciated in the second trimester, but if you have already started feeling it, every day it should be the same. Okay, there should never be a day where you felt less movements or something like that. So a proper way or a good way to check for the baby movements is every time after your breakfast, lunch and dinner, lie down on your left side and count for 1 hour. In that 1 hour you should at least feel 4 to 5 movements. Okay, you need not keep a track on the whole day how the baby is moving. At least after your major meals, lie down on your sit in one place or lie down on your left side and watch for the baby movements. It's very, very important. When you're at home, there is no way to know except for watching for the movements how the baby is doing inside. Yeah, and every time you go to the doctor will definitely check for the baby's heartbeat and everything, but most of the time you will stay away from the doctor and you are all on your own, and you are the only person who will know how the baby is doing inside. Yeah, so fetal movements are very, very important. And next thing is, if you see any sudden increase in your weight, if you see your feet is swollen up and your eyes are puffy, and if you're feeling blurring of vision, severe headache and nausea, vomiting, these all might be the signs of preeclampsia also, in the sense higher blood pressure. So these are the symptoms you should definitely know. And any form of bleeding and any form of watery discharge should be at rest. In the sense, any form of bleeding is not normal in the second trimester. First trimester you might have, but second trimester you should not have bleeding, and you should definitely not have any watery leaking. Yeah, so that's called the amniotic membrane breaks. That is when you have water leakage. So in physiological discharge is also very, very common in pregnancy. But if you have any doubt that you are feeling wet down there all the time, and if it's wetting your clothes, pants and all, so definitely you should go to the doctor. So these are the symptoms and signs you should be aware of in the second trimester. So by the time you reach 28 weeks, so these are all the things you will experience, and these are all the things the baby will have. Did I tell you that the baby will have developed a sleep and wake up cycle also at this stage? Baby will sleep for a particular duration of time and it will be waking up. Yeah, you can appreciate it also when the baby is sleeping, and then they can sleep at a time for continuously for 90 minutes to 1 hour also. Yeah, and they can start listening also. So it would be a good time to play some good music and maybe tell some stories to your babies as well. Yeah, so I guess that was all about your second trimester of pregnancy. If you have any doubts regarding it, comment me below. I'll be more than happy to clarify your doubts. And if you like this channel, consider subscribing. I'll see you all in the next video about the third trimester of pregnancy. Till then, take care and drink plenty of water. Bye bye.